Madam Deputy Speaker, I beg to move that leave be given to bring in a bill to make provision for the purposes of increasing uptake of NHS breast screening programme appointments, including groups currently less likely to take up such appointments, to extend eligibility to that programme to persons at an increased risk of breast cancer because of their family history, and for connected purposes. Last weekend saw, of course, Mothering Sunday. For many of our constituents, that meant a time to catch up with mum, maybe have lunch, maybe go for a walk or buy some flowers. My little ones did that for my wife. For some, however, Sunday was not a day for lunch or a walk or a catch-up. There were flowers, but they were dropped off at the churchyard or the crematorium, as they are every year. And that, Madam Deputy Speaker, included me, as it has done for the past 19 years. I was in my late 20s, away on my stag do in Wales, when I got a phone call very early in the morning to say I needed to get home. My mother was in hospital by that point with only one possible outcome, and she passed away a few days later, 5 weeks before Susie and I got married. She was just 52 years old. Now, they say events and life before we enter this place shape how we approach some of our time here, and they're right. Colleagues here and constituents in Winchester and Chalmers-Ford know this is an issue I'm passionate about, and now they know why. For the first 5 years as an MP, I co-chaired the all-party breast cancer group, and then in 2017 it was the privilege of my life to serve as the cancer minister. And we said then, as now, that for cancer, an early diagnosis can be game-changing. Cancer's magic key, as it's often been put. And breast cancer is an incredibly treatable cancer if detected early. 98% of women who have the disease detected at stage 1 survive for at least 5 years after their diagnosis, and many of them go on to lead full lives. And it's true that we've made huge progress on tackling cancer. Indeed, survival rates have been increasing year on year for the past decade or more, and have doubled for the last 40 years in the UK, thanks in large part to more cases being caught early. Our NHS breast screening programme is estimated to prevent 1,300 breast cancer deaths every year across the UK, but we need to go further. That's even more true today as it was pre-pandemic, when you consider, according to figures from NHS England's latest cancer waiting times, there are nearly 9,000 women in England living with undiagnosed breast cancer due to the impact of COVID. The pandemic has, to put it mildly, not helped our efforts to detect breast cancer earlier through screening. I want to put on record my thanks to the staff at Hampshire hospitals and in breast screening centres across the UK. They have worked, and they continue to work, tirelessly to pool and expand capacity so that catch-up appointments can be offered to those women who weren't screened while the programme was paused. Despite all this hard work, between April 2020 and March 2021, around 936,000 fewer women in England were screened for breast cancer compared to the previous year. Routine breast screening appointments were suspended in March 2020, a mistake we must never repeat, and restarted over the summer of that year, but we are far from fully recovered. The latest breast screening performance data for England showed that the percentage of women taking up their screening invitation within 6 months has reached a historic low of 62%, well below the national minimum standard of 70%. My fear is that this will be another of the terrible legacies of the pandemic, even after all the delayed screening invitations have been sent. The long-term impact of this disruption will depend on how quickly screening services can fully recover, not just in offering the catch-up appointments, but in making sure as many women as possible accept that invite. Reducing the shortfall in the number of women screened is key to identifying the majority of missing breast cancer patients and ensuring all breast cancers are diagnosed as early as possible. While addressing the invite backlog and the drastic drop in attendance are the most immediate priorities, we cannot deny that breast screening uptake was already in steady decline before the pandemic. COVID has simply accelerated this trend with potentially tragic consequences. So I welcome the government's new 10-year cancer strategy, and I praise them for continuing to take action on early diagnosis of cancer. I urge them to view this new cancer strategy as an opportunity, and I know they do, to double down on that mission. This bill will help the government to sustain focus and ambition on maximising uptake in the NHS breast screening programme, both in this recovery phase and into the future. Going further, this bill will also help ensure that this is delivered in an equitable way, which will be instrumental to addressing the long-standing disparities seen in early cancer diagnosis. Research shows that in the UK, women from ethnic minority backgrounds and those living in areas of high deprivation are less likely to attend routine breast screening. These groups are also at greater risk of being diagnosed with later stage breast cancer and have worse survival rates. It's essential that efforts to recover the screening programme do not inadvertently undermine the government's commitments on early diagnosis, especially its ambition to shrink the inequalities gap. That's why some of the measures taken to try and to improve the screening programme's efficiency during recovery, most notably the switch to an open invitation model, have raised so many concerns. Previous research indicates that when people are asked to call and arrange their own screening appointment, uptake is lower than when they're provided with a timed appointment. Now, without sufficient funding, staff and community engagement, permanently switching to an open invite model risks further deterioration in uptake and fewer breast cancers being detected early. It is vital that the impact of open invitations on uptake of breast screening is fully assessed before any long-term decisions are made. This bill will help ensure that data relating to equalities is collected and used to fully assess the impact different invitation models and interventions are having on uptake and its variation across the different groups. I'm grateful to the work the Department for Health and Social Care is doing to prepare a white paper on health disparities. I look forward to working across the House to tackle those inequalities. The proposed bill is just one way to get started. It's vital that as we recover the NHS breast screening programme, we do not miss the opportunity to look into the future and prepare for some of the much needed changes that are likely to occur. I commend the Government for exploring with their 10-year cancer plan a call to evidence around the increased testing of family members of cancer patients to determine whether they are at increased risk of cancer, which could have implications, of course, for the screening programme in the future. Right now, women at a very high risk of breast cancer because of their family history receive more frequent screening through the National Screening Programme, and women at high or moderate risk should receive this through locally commissioned screening services. But research suggests these locally commissioned services are not fully implemented in many regions, as they're not mandatory and are subject to financial constraints. This is a missed opportunity to diagnose breast cancer in at-risk women at the earliest opportunity. Professor Sir Mike Richards' 2019 review of screening service, which I and my right honourable friend from South West Surrey commissioned in office, recommended the establishment of a new single screening advisory body to make recommendations on both population and targeted screening, commissioned through similarly nationally agreed standards and service specifications. Now, the Government has recently announced that the UK National Screening Committee will be relaunched this spring, with an expanded remit covering targeted screening. However, nothing further has been announced yet about giving recommendations on targeted screening equal weight and funding, as Sir Mike suggested. This bill will take steps to ensure that Commissioners fully implement existing NICE recommendations on screening for women at moderate or high risk of breast cancer as a result of their family history. Now, the excellent Minister on the bench knows how important this issue is, and I believe every member of this House can agree on the importance of early, equitable diagnosis of breast cancer and the central role of NHS breast screening programme has in achieving that. We need to up our game pre-COVID, and we certainly need to up our game post-COVID if we want to avoid being back here in the next 10 years having exactly the same conversation. I think by working across the political divide, we can get back on track to ensure and improve the early diagnosis of breast cancer. And it won't save Mothering Sunday for me, Madam Deputy Speaker, but it might for thousands of other people in the future. Thank you very much.